Welcome back. It is time for your health check. Today is World AIDS Day. And you might think, if you don't have it, it doesn't matter to you. But here's why it should. The latest estimates from the CDC show about 34,800 new HIV infections in the U.S. in 2019. Further, roughly 1.2 million people in this country have HIV. But get this, 13% of them don't know it, and this reinforces the importance of routine testing. Joining me this morning is Dr. Carlo, CEO of Prism Health North Texas. Thank you so much for being here with us. So it has been 41 years since the beginning of this AIDS pandemic. I think a lot of people want to know two things. One, what is the greatest achievement to this point? And two, will we ever see a cure in our lifetimes?
Well, we have to be incredibly thankful that we have great treatment. And we've had great treatment since 1996, and it's made such a huge difference in so many people's lives. So thankfully, we have a great treatment that actually can keep the virus completely at bay and won't prevent any further transmission. So really great treatment. So we have the tools to end the epidemic in our lifetime, but we still have a lot more work to do in order to reach that goal.
Why would you say that HIV is still problematic in the United States specifically?
Well, it starts with education. We still need to understand and really communicate dispel the myths. There's still a lot of misperceptions out there. There's also a lot of stigma, a lot of disease shaming that still exists that really prevent people from coming forward and getting tested. And lastly, it's about health equity. And until we have access to health care wherever you live in this country, it's going to continue to be a problem.
Now, you mentioned some of the treatments and the developments and the advancements around that. I'm wondering, what about prevention in the first place, aside from what you're talking about, screening, education, resources?
You know, we have new tools in prevention that actually include medication that can be taken once a day that actually can prevent HIV infection altogether. In addition to that, we're getting new therapies such as long-acting injection medications that actually could prevent HIV transmission in taking that as infrequent as every 6 months. So, there is a lot of great preventive treatment. It really starts with increasing the education and awareness and making sure we have good access to affordable health care.
So thank you so much for all of that. Dr. Carlo and I are going to be on I Am Still Up on Facebook Live on the Daybreak Facebook page right after the show so that you can ask questions and we can have a more in-depth conversation about this. By the way, Texas Health Action's Kind Clinic is going to be providing free HIV testing at their Dallas location tomorrow from noon until 9 p.m. So this is the Kind Clinic on Oak Lawn and Cedar Springs Road inside the Walgreens there.